นับตั้งแต่ครั้งแรกที่คุณหมอแจ้งข่าวร้ายว่าเป็นมะเร็งสุดที่ต้องยอมรับความจริงให้ได้ก็ว่ายากแล้วแต่ระหว่างทางที่ต้องรับมือกับการรักษามันยากกว่ามากต้องใช้ทั้งพลังกายและพลังใจให้ลุกขึ้นจากจุดที่แย่ที่สุดมาให้ได้แต่ถึงจะเอาชนะมะเร็งมาได้แล้วในใจลึกๆก็ยังกลัวว่าข่าวร้ายจะเกิดซ้ำอีกในวันนี้ฉันได้โอกาสที่จะกลับมาใช้ชีวิตอีกครั้งและครั้งนี้ฉันจะใช้ทุกนาทีให้คุ้มค่าเพื่อต่อยอดทุกช่วงเวลาที่มีให้ดีที่สุด
ที่รักษาเวลเนสเราเข้าใจว่าคุณต้องต่อสู้กับความกังวลและความกลัวมากแค่ไหนกว่าที่จะผ่านเส้นทางแห่งฝันร้ายนี้มาได้
เราเข้าใจถึงความเปลี่ยนแปลงด้านร่างกายและจิตใจที่คุณต้องยอมรับ
เราเข้าใจว่าทุกครั้งที่คุณเข้ารับการรักษาคุณหวังว่าครั้งนี้จะเป็นครั้งสุดท้ายและได้รับข่าวดีกลับไป
We understand that you have to handle all the pressure for yourself and others to continue carrying on with life each day
เรารู้ว่าคุณเหนื่อยง่ายเพราะเคลื่อนไหวร่างกายไม่ได้ดังที่ใจคิดเหมือนเดิม
ความเครียดที่เกิดจากการรักษาทำให้คุณไม่มีความสุขในการรับประทานอาหารอย่างเมื่อก่อนเราเข้าใจ
เราจึงพัฒนาโปรแกรม Esperance Cancer Care เพื่อดูแลสุขภาพร่วมกับการรักษาและป้องกันมะเร็งแบบเฉพาะบุคคลขึ้นมาเพื่อคุณดูแลและติดตามผลการรักษาอย่างใกล้ชิดโดยแพทย์ผู้ชำนาญการด้านมะเร็งและการรักษาแบบผสมผสานจาก Esperance Integrative Cancer Clinic บำรุงราษฎร์ร่วมกับแพทย์ผู้ชำนาญการด้านเวชศาสตร์ชะลอวัยจาก Vital Life Scientific Wellness Center โดยเลือกสรรการบำบัดจากศาสตร์ตะวันตกร่วมกับศาสตร์แผนแพทย์ทางเลือกตะวันออกที่จะช่วยเพิ่มประสิทธิภาพของการรักษาให้ดีขึ้นอย่างตรงจุดป้องกันการกลับมาเป็นซ้ำในอนาคต รวมทั้งฟื้นฟูสภาพจิตใจให้คุณได้ผ่อนคลายและพบกับความสมดุลพร้อมรับความสดชื่นสูดรับอากาศบริสุทธิ์ได้อย่างเต็มที่ท่ามกลางธรรมชาติและนอนหลับได้อย่างลึกสงบอย่างไร้กังวลได้ลิ้มรสอาหารอย่างมีความสุขที่รังสรรค์โดยเชฟและนักโภชนาการด้านมะเร็งอย่างเหมาะสมที่สุดต่อเงื่อนไขด้านสุขภาพของคุณพักฟื้นจากช่วงเวลาที่ยากที่สุดด้วยการฟื้นฟูในทุกมิติทั้งร่างกายและจิตใจพร้อมกับก้าวใหม่ที่มั่นคงขึ้นจากผลข้างเคียงของการบำบัดรักษาโดยผู้ชำนาญการด้านการออกกำลังกายในผู้ป่วยมะเร็งที่จะวิเคราะห์และฟื้นฟูความแข็งแรงกลับคืนให้แก่คุณเพื่อสานต่อความฝันครั้งใหม่เพื่อสร้างแรงบันดาลใจให้กับคนรอบข้างและเพื่อความมั่นใจว่าคุณจะไม่กลับมาเจอข่าวร้ายซ้ำอีกเตรียมความพร้อมในการเดินไปข้างหน้ากับก้าวใหม่ของชีวิตที่คุณมีโอกาสได้ใช้อีกครั้งได้แล้ววันนี้ที่รักษา
Good afternoon, everyone, and welcome to another Facebook Live session organized by Esperance Integrative Cancer Clinic, which is also a subsidiary of Bumrungrad International Hospital, where we give confidence to manage your challenge. My name is Mira Mezahem, and I'll be your host for today. So before we begin, when we talk about health and sickness, I know that there are many types of diseases and different illnesses that could be terrifying and that it could be life-threatening as well. However, if we leave them untreated, this could be very dangerous. This also includes cancer. And as we know that cancer is one of the most serious diseases in the world and that it has been affecting many individuals around the world. However, in today's society, nowadays, it has been more common than it was before. And in some cases, unfortunately, some cancer patients, they were unable to figure out that they have cancer. And eventually, when they found out, it's already too late to treat it. But in some other cases, the cancer patient themselves, when they found out through the traditional methods like scans and markers, the results, they can be unreliable sometimes, which this does not make an effective contribution to the treatment. With these concerns and issues that we have, it brings us to today's topic where we will be exploring of what are the alternatives that we could find out whether we have cancer or not through early detection. And along with addressing some of the warning signs or signals of cancer that we may be able to recognize them. So without further ado, let me introduce our special guest for today who will be giving us answer of our questions. He is also our Naturopathic Consultant at Esperance Clinic. So let's welcome Dr. Brian Kunakom.
Sawasdee krab. Thank you so much, Mira.
Hello, Doctor. How are you today?
Good. Really delighted to be here.
All right.
I hope I can shine some light on this topic.
Okay, I hope so too. All right, so let me get to the first question, which is very obvious here. What is an early detection and how important it is?
So early detection is one of the best methods we have so far, traditionally and conventionally, for detecting cancers early. Can I have the first slide, please? Where we actually see that in the past, we wait until we get a disease. Right? We feel sick, we wait for symptoms. Then usually most of the time when we get symptoms, it's a little bit too late because people would think, oh, I start getting sick the moment I have symptoms. Actually, no, our body starts deteriorating first, but our body is so smart that it's able to combat these symptoms for quite a while until we're really sick. So by the time we hit that phase, we're not in stage 1 anymore when we talk about cancer. So when we look at this graph, if you look carefully at this, I know it's a little bit small, but let's take the first graph there. We're not going to talk about all of them. That's for breast cancer. We can see that the bar graph highest for the first bar, we see that if it's in stage 1, if we catch the cancer early in stage 1, usually around 99% of the people will live after 5 years. That's called survival rate. Okay. Now, if we catch that later in stage 4 or stage 3, stage 4, the percentage goes down, and the survival rate goes down to sometimes 30%. So that's a huge difference. Right. So that's why it's very, very important for us to do early detection. We don't give enough credits to mammograms, but science has evolved a long way, where we went from finding breast cancer in stage 4 quite often to actually finding all the breast cancer in stage 1, right. Which means if we have 100 people in this room, 99%, if we catch them in early stages, will actually survive after 5 years, versus 100 people in this room, and if they get stage 4, that's a 30% chance. So only 30 out of 100 will actually be living after 5 years. So that's what this bar graph means.
Right. And what about like in some cases where people might think that, okay, for example, I'm healthy. What if I just wait until the symptom shows? Like, oh, maybe I don't have cancer, but once the symptom shows, I will get treated by then. Like they could think that the early detection could be an unnecessary expense in this case. So like, for example, if they also don't have cancer and they took the test, the detection itself, and turns out that they don't have cancer, like it could be a waste in their thoughts. So do you consider early detection necessary for those who think this way?
I absolutely still think that early detection is still important. So actually, insurance programs have come out to cover early detection, right? That includes mammogram, ultrasounds, low-dose CT scans, or even colonoscopy. If we don't have these at all, and we really wait for symptoms, like I said, when the symptoms does show up, it's not stage 1 anymore. So it's a difference between going to see a doctor, right, without any symptoms, but you have a 99% chance of living, versus walking to an office with symptoms and you have 30% chance left. We don't know at which point whether this symptom is severe or not, because people have a subjective way of indicating what pain scale they're at, or sometimes what the severity in which their symptoms are at. For example, for me, I have a high pain tolerance. Well, I think I do, right? So whenever it's a 5 out of 10, it might mean a 10 out of 10 for someone else, right? So that's why when we go off just symptoms and deciding whether these symptoms are severe or not, it becomes quite difficult to navigate, because all of us would always be biased. We would always love to think that we're healthy. Therefore, these symptoms would be minor. Like, for example, if you have like a stomach ache, right? I don't think you're going to be rushing to the hospital because you had stomach aches all the time. But what early detection has done, or early screening has done, is that we have checkup programs annually. That means you have symptoms or not, you show up, we do the test for you. And if it's negative, it's not a waste, right? It just tells us that, hey, I'm healthy. That's just one way of evaluating whether I'm healthy or not. And for those of you who actually think that exercise, diet really helps, right? How do you actually know?
Oh, that's true.
If we just say, oh, I feel good today. Well, I feel great every day. Right? When I drink coffee, I feel great too. Does that mean I don't have cancer because I drank? That's actually not true. So a lot of times we don't actually know that we don't feel well. So when we actually do these early screening and we show up, the least that will happen is that it evaluates us, that we're actually doing a good job of taking care of our health.
Right.
Like if we have high cholesterol, right? And for the next year, you want a lower cholesterol, you do these dietary changes and you get the results that you want. How would you know? You have to go and check, right? So that's the idea about early detection. And I think we've come to a point where people have different priorities in life. Totally understand, if health is not your number one priority, then you're probably going to say it's a waste of money, right? For someone who's still young, they feel healthy, they would feel like, okay, They don't have much money to spend on this. So it's understandable that their priority is not health at that time. It might be career, it might be family, it might be studies. So that's totally fine. But if you are really prioritizing health and you're telling everyone you're prioritizing health, then this should actually be the simplest thing you can do to evaluate yourself.
Right. So it doesn't matter whether you can tolerate the pain like or much or not, but it depends on how much you want to make sure that you are healthy on the inside rather than what you feel.
Exactly. So getting objective results, seeing results on paper, we can actually quantify it.
Right.
Not pain scale wise, right? We can quantify pain scale, but actually you're seeing the biomarkers that when you go to a hospital, you get tested through health programs, and we can actually see all these numbers in general. So being more objective rather than subjective, I would say.
And what about some guidance to some people who are afraid of going to a hospital or getting a health checkup because they might feel like if they were to check their health, they would suddenly get sick. Like there's some people who believes in that way. So how would you like recommend them to like not be afraid of hospital or doctors like that?
So treat the hospital. Doctors are not here to actually tell you what to do, right? We can't make you do something. We are able to give you advices. Think of us as like signs, right? We tell you if you don't do this, statistics shows that this might happen. Funny thing is, most recently, I just got a sleep test done, right? People would be like, why are you getting a sleep test? You don't look that obese or anything. Are you snoring? Things like this. Well, yes, I do snore. Therefore, I feel like I want to make sure that this will not impact my health in the future. People who snore tends to breathe lesser. So sometimes we cut off oxygen while we're sleeping without even knowing, right? Because we're not conscious at that time. Then the next thing we know, if this happens for 20, 30 years, then the blood vessels work harder. And then the next thing we know is hypertension, eventually leading to cardiovascular disease. So the reason why I did this is because I wanted to take action to see what's going to happen. Am I afraid of it? Yeah. I have a feeling that I would get a diagnosis the moment I walk in, right? I know that the cost of getting the treatment will be expensive too. I totally understand that. But sometimes when I'm thinking about a long-term plan, when I'm thinking about, I don't want this problem at the age of 50, 60, it makes me think that, okay, I need to address this. And when I say I don't want a problem, I mean, I want to be able to walk up a hill, run, play sports at an older age. But if I have hypertension, have cardiovascular disease, that actually impacts me from doing all this. Worst case scenario, I get cancer, right? Then I can't enjoy all this in life. So that's why I'm addressing it now at a younger age. So for all of you who are actually afraid of getting checked up because you don't want the diagnosis, you don't want treatment, totally understand. But sometimes when you have to go back and like take a step back and reflect upon what's your lifelong goal, and if health is actually on top of that list, then it really does conquer the fear. It took me a while to go get this test. It's not like, oh, I want to do this right away. I mean, the doctor had to address this for months, right? And I didn't take the initiative like 3 or 4 months later because I felt like I was scared. But after a while, in my head, at the back of my mind, there's always something there saying that prevention is more important. And that's why I took the steps and conquered the fear. So sometimes we have to go back to our goals, dreams, priority, and see if this would actually surpass your fear. And eventually for me, it did.
So I guess it's quite normal for everyone, like including doctor himself. He's also scared of going to the hospital and getting checked up. So I guess it's pretty normal for you guys as well. If you ever feel scared, like me, myself, I also feel scared. Like the last time I went to get a blood checked up, I also I didn't want to go, but I still had to go so that I could evaluate the things that's going on in my body so that I can know that, okay, I'm going on the right track of being healthy or unhealthy. So, all right.
Can I add to that as well?
Yeah, sure. Go ahead.
So the idea is that once you go through that process, right, keep in mind, you do have the power, right? even if we prescribe something for you or give some treatment, you still have the right to say no, right? Because it's your choice.
Yeah.
When you say no, it means I already know the consequences and I'm willing to accept the consequences. I'm not gonna put the pressure on the doctor anymore at that point, right? Not recommend it, but keep in mind, it's better to know than not know. And after knowing, you still have time to weigh your the benefits versus risk. Without a disease, it's very easy to weigh the benefits versus the risk. But with a disease, when you need to get treated right away, then you can't weigh anything out. You just have to go through treatment. Yeah. So that's another reason why we do early detection. So we have time to weigh out what we want to do.
Right.
Yeah.
And I think this also applies to like people at the young age, like early 20s or early adults as well. Like even if you're young, I think it's also necessary for you to do like early detection or checks up as well, because you never know like what's going on inside until you get it checked, if that's correct.
Absolutely, yeah.
All right, and as I previously mentioned earlier about the traditional methods like scans and markers in the case for cancer, they appear to not be always dependable from time to time. And correct me if I'm wrong, if it's like these methods are time consuming because they could be performed like once a year, like it's recommended to do once a year, right?
Most of the time, yeah.
All right, so with these, how would you compare the effectiveness or the efficiency between the traditional techniques and the early detection methods?
So there's many ways to do early detection. And actually, let's take a step back a little bit. The way that we monitor cancer, that is early detection on its own. It's just that we have newer techniques now, right? But again, we have to give credit to the old techniques. And the old techniques are still being used today. Let's just say that when it's positive, then it probably is beneficial to do it. But when it's negative, a lot of times people feel like, what else is there to do, right? So let me bring up another slide to show this. And I totally understand where you're coming from. We actually have a screening guideline, right? So we have a timeline. This is not for all of them. Let's just say, this is just for an example, I would say. So for example, cervical cancer, we start screening women when they're sexually active, or if not, then at the age of 20. In this diagram, we'll see at the age of 21 or above. Then we start seeing screening of breast cancer at the age of 40, right? We don't start these screening programs until these ages. The problem arises when, let's just say someone develops breast cancer before the age of 40, because they've never been, the guideline says to start at 40, right. But if they start getting cancer at the age of 30, then this becomes irrelevant, right? Now, the reason why people don't want to get it is because it's expensive. And most of the time when we're young, we don't think we're gonna get sick. So now what we have developed is that it comes with public education too, where we actually tell the public, hey, look, these are the guidelines. It doesn't mean that you can't do above and beyond, right? For example, we're in school. We want the highest grades. Yeah. Back then we want A's. A's like what, 90% or above, right? B's is like 80%. But the passing grade back then for me is like a C, right? 75%. Oh. Right? So if I want to pass, oh, that's high. Okay, let's just say 60% then. Okay, that's right? Average then. Okay, so it's just to not put pressure on people. We can even make it 50%, let's put it that way. So if we want to pass a class, you need to get 50%, right? Technically, your job is to get 50% and nothing more, just to pass the class. Right. But some people, we don't want that because we want more leverage in life. So what we do is we try to study harder and we try to get 90%. Do you really have to do that, technically?
No.
Not really, but our parents would start yelling at us, right? So the idea is that if we're going through these health programs, think of it as you're going through life for your health at 50, 60% passing grade. But if you want more than that, what do you have to do? In studying, we gotta study more. We buy more books. We go through extra classes. We take extracurriculars, right? For health screening, we have to pay for it ourselves, right? Is it time consuming? Mammograms are getting shorter and shorter. It's actually pretty fast. Colonoscopy might take a little bit more time. That starts at the age of 45 according to this diagram. In Thailand, it's 55 years old. Unless you have some significant history, then it's earlier than that. Low dose CT scanning for lung cancer starts at the age of 40 in some countries. So a lot of times these are just guidelines. And if you go through the guidelines, the insurance will pay, right? But if you want above and beyond the guidelines, then that's in our hands. We got to pay ourselves. Do you need to? No. Is it optional? Yes. It depends. If you want to be an overachiever in class, you got to do more. So that's the general idea.
Right. And so let's say if before the age of 21, if those individuals would like to do a checkup, does the hospital require like an age limit, or you have to be like above 21 to do the checkup, or you can just check up at all ages?
If we're talking about cervical cancer specifically, right? So what we actually do is we start asking a question, how early on are they sexually active? If they're not sexually active, then most of the time we'll say it's probably not needed. But if you still want to go through it, depending on your age, right? Then if you're an adult, then probably you can give consent. But if you're not an adult, then we have to ask the parents.
Right.
If everyone agrees, then anyone can do the checkup pretty much. So that's why we recommend based on guidelines. And this is the idea behind, like, you have to go see a doctor and they can recommend for you. Otherwise, people would just be rushing to the hospital and be like, I want to do this, I want to do this. And it's like, wait, you're not at that age yet. It's probably not recommended. It's not, and that's where the waste of money happens, right? And I noticed that I haven't answered one more question where you said it's ineffective to go through the traditional way.
Yeah.
Can we have another slide, actually? This is actually a study that they did. And they actually showed the statistics of showing if you have no screening at all, right? The 5-year survival, if we do find cancer, right? It turns out to be 20%. Let's just say out of 500 people, we'll still have 100 people alive. This is in the case of no screening and that person develops cancer. That's the statistics. When we have effective screening, out of those 500 people, we double the outcome. That means instead of 100 people stay alive, we have 200 people staying alive after 5 years. Now, some people are like, but that's very little because that's 50%. Some people, like I said, passing grade 50%, parents aren't happy. So if I'm telling you that this is a passing grade of 50%, some people will be, that's ineffective. To doctors, to a wide community, this is actually quite effective, right? And this is the power of effective screening. When we look at the number, we can see that we doubled the statistics of success. But for some people, it's just not enough. For some people, it's just not enough, like me.
So you would want more than 50% then?
Absolutely, right? I mean, when we're talking about passing grades, do you want 50%? Not even for my parents back then, right? It wasn't only about grades. It was like, it's for my own ego. It was like, wait, if I get 50%, that puts me probably at a failing grade in school, and the teachers won't be too happy. All my friends will start laughing, right? And that's where the downplay and that emotional trauma happens. But when it comes to health, we totally forgot about this. We were like, 50%, let's do it. It doesn't even matter. We'll just pass on this. So the thing we're talking about today is not just early detection, right? It's like, because there's early detection conventional way, and there's early detection with extra technology. The extra technology puts you above the 50%. So when people feel like this is ineffective and they want more, we have something. Technology has advanced so far that we can offer more.
Right. Oh, okay, that's great then. And let's consider the cases where we know that cancer has been going on for. And for like me, myself, as a young adult, I know a lot of people who have been trying to avoid having children of their own so that they wouldn't risk of passing the cancer genes or the genetics to their children. So what are your thoughts or comments about these assumptions?
So I wasn't even aware that people don't want kids because they want to pass on their genes, right? we are getting more information about genetics. Apologize for the sound in the background. This is a hospital, but totally fine. We actually see that genetics play a big role in the past because back then when I was still in school, we believed that genetics define everything. If it's in our genes, it's going to happen. Right? That's what people believe. But that's not actually true. If that were to be true, right? If you have the genes, that means the moment that you're born, you should get cancer right away, right? But why does it take 40 years to develop, right? It doesn't mean that because the cancer gene will not be expressed until 40 years. That's just not how it works. It's not like someone who's a kid, they develop later in life and they become an adult and their adult genes start activating, they start getting cancer. Maybe that's true, but we also have good and bad genes, right? The good genes will protect us. The bad genes will give us the cancer. And let me tell you this, for thousands of years, our genes have not changed that much. So the mutation is there. We just found out a way to discover it, right? If the mutation is becoming more and more common, I'm talking about genetic mutation that's being inherited by our ancestry. Someone in our family tree gives us the gene. It's always been there. Otherwise, we wouldn't be having it, right? So not having kids for this reason might actually not be a good reason enough. You might have to find other reasons not to have kids. Do we have the next slide? I actually like showing this slide as a good reference. We see that we have two types of genetics. We have genetics that we acquired, we mutate during our lifetime, which means we didn't get it from our parents, versus the one we get from our parents. The one that people are scared of usually comes from our parents. Now, if we look at that pie chart on the left, we'll see that 10 to 15% of cancer being detected actually comes from our genes. The familial means that we live in the same house, we probably eat the same thing, we breathe the same air, we do the same activities, eventually leading to the same type of cancer. The rest, they call it sporadic, which means random. But honestly, the way I see it is we do know what increases the risk of cancer, right? And we have studies on this over and over again. We found that, now let's look at the bar graph on the right. The increased risk of cancer, that's highly associated, actually, the lifestyle factor that actually increases the most risk would be tobacco use. We'll see that as almost 20%. We'll see that people who have higher body weight, excess body weight, have almost 10% of getting increased risk of cancer. The next one is alcohol consumption, followed by ultraviolet radiation. Then we see poor diet, if it's inhygienic. Next risk factor would be infections, followed by physical inactivity. Obviously, we do not have just one of these risk factors most of the time. In this day and age, we have more than one, and they really do add up the statistics. These lifestyle factors actually express the bad genes, and they actually cause the mutation to happen faster. So a lot of times people who develop cancer did not come from genetics, because the one from genetics is only 10%. The other 90%, 85% to 90%, usually comes from acquired mutation during their lifetime. So your lifestyle really matters. What you eat, what air you breathe, the way you take care of your health. If you have an infection, you haven't treated it yet, then that might develop into cancer. One of which that we found is HPV infections. The other one would be H. pylori or H. pylori in the States, pylori in this region. It usually happens in our gut. It happens with the ulcers. If it's untreated, it can develop into cancer. So all of these increase the risk of cancer. That's why when I said that whether or not we can prevent if we actually control our lifestyle. But for someone who has who already have the genes, it might increase the risk by a lot more. For example, BRCA1, BRCA2 associate risk with breast cancer. As we know more about genes, it's not just breast cancer. Males can also be affected by these genes too, right? Remember Angelina Jolie, we always make this example, right? From BRCA gene. What she did was she got prophylactic mastectomy, which means she removed her breast to prevent cancer, because there's a lot of people in her family tree who got cancer. And she does have this gene. So those are examples of genetics. But keep in mind, like I said, if you have the genes, your lifestyle will determine whether you express those genes or not. If you have bad genes, you still have a copy of good genes, right? So the good lifestyle would actually prevent you from expressing the bad genes. So that is actually the idea behind it. So if you do have the genes, honestly, you still have to look after your lifestyle.
Okay, so you're saying that, so for example, if I have a family members that has different types of cancer, but if I were to stay healthy and keeps my lifestyle in a positive way, then I wouldn't trigger it.
Exactly. And how would you know that you're not triggering it?
That's what you need in
early detection, right? So we're going back in a full loop.
Right.
If you do have these genes, the guidelines tells us that we can actually check at an earlier age. So the insurance companies actually would cover if we do have these genes, and the doctor has already put in an indication that you need to have a closer surveillance of cancer.
I see. That's interesting, actually. All right, and since you're saying that our DNA or the genetics that we get from our parents are like less likely to develop cancer, only if we trigger it with our lifestyle. So I want you to add a little bit about the lifestyle habits or the choices we could do, like the preventions that could keep us in the healthy direction.
So we should always think about things that we're in control of, right? Sometimes there's a lot of things we're not in control of, mainly like pollution. It's hard to control the air because that's what we share with everyone, right? We can't be wearing air purifier suits around. I mean, you can, but nobody does that. And just wearing a mask is already uncomfortable. Think about things that we can actually control, such as food and exercise. These are the two things that we're actually in full power of, if you ask me. The food choices that we eat. I gotta say that in this day and age, food has tastes a lot better compared to before. I'm gonna tell you that popcorn does not taste like before anymore. It used to just be butter and salt, right? Now it's popcorn with caramel, truffle, some kind of oil. And I'm pretty sure that when we add all these things in, we notice that we add more sodium, and people are worried about sodium sometimes because of hypertension. We add more sugar. We add extra stuff to make them taste better. Some extra stuff, I have no clue sometimes what they are. Patients would walk in and say, hey, I have this package, it says INS and followed by some number. I have no clue. So the best way, if you have no clue what that is, most likely either A, you gain more information about it, you do the research, or B, don't eat it, right? There's something called whole foods. Whole foods are foods that we can see in its natural state, such as fruits. When we cook something, I understand some people might not call it whole food. So, but we've seen what it looks like in its natural state. For example, we eat meat, right? We know that raw meat, what it looks like. Then when we cook it, we know that it's safe.
Yeah.
The only problem is when it's in packaging, they said that they cooked it a certain way, but they don't tell us what's in it. Now, I consider that processed food or some risky food. Most of the time, food companies are good enough to tell us what it is. Most of the time. And that's where my pet peeve comes out. So I actually tried for over a year, and I know some people tried for many years to try to avoid processed food. And it's really, really hard. We've been told about vegetable oils being really good for us, which it is in its cold press form, which means it hasn't been through heat several times. But when it's been heated up, these oils that contain good fats are not good fats anymore. they are trans fats, which increase the risk of cancer. Can you, actually, I don't want to say that, but I'm just going to tell you the answer to that. Usually when you go out to eat and they're making food, stir fry, especially in this region of the world, they use oil, right? And it's plant-based, some plant-based oil. They heat it up. But before they heat that up in the bottle, to produce that same bottle, they have to heat it up 5 times.
Oh.
So going into your food, that's number 6.
Oh,
imagine how
that is
many
true.
trans fat have we created compared to the original form. Versus the original form, cold press, you get the freshness in it. So that's the huge difference. So I'll say food, try to go whole foods, eliminate processed food as much as possible. There's so much data on processed food, but we just love the taste of it, right?
They're really good.
Everything just tastes so good. After we do that, we'll notice that we have more energy level. Exercise then becomes important. Our body is designed to walk, to crawl, to climb. Being at a desk, that's a modern day thing. It's needed. I do it too. But if we don't exercise, then our body starts to break down. A lot of times we think that it's associated with pain or like musculoskeletal pain. But what we actually find out is when we don't exercise, we cause more problems than that. Our immune system gets affected. The best way to increase your immune system or make your immune system more effective is actually exercise. And not just like once in a year, right? It has to be consistent.
Yeah.
And if you don't want those pains, exercising all the time, you'll notice that those pains don't come. Even with our daily activity. For example, we're on a bus, we're on a train, sudden stop happens. We don't have the muscle for it. We fly forward, injury happens. So just simple things like this, right? Exercise just decreases the risk of mortality in general. But when we talk about cancer, in the past, we never think about cancer associated with exercise. But during COVID times, it's become quite clear that guidelines actually came out and say, hey, maybe we should do guidelines for exercising during COVID times. And it's like, really, we didn't see that before? So it's something that data has shown and has become more and more clear these days that exercise is not just associated with overall pain, but it's actually associated with overall health and longevity and preventing cancer, pretty much.
And what about those people who, like, if they're like young, maybe they try to avoid going to the healthy direction because they want to like live their life and stuff like that. So what are your recommendations for them?
Understand that when you're young, it's fun, right?
Yeah.
To do this and that. Definitely staying up late, going to parties. Not everyone, but most of us been through that.
Yeah.
But I gotta say that if I could go back in time, but I couldn't, I would be, and if I did control my health better, I would be so much more energetic today. I would be so much more strong and more effective at work. I understand that sometimes fun gets into the way. Fun is important. That's one of the social component that we need, right? So if we don't have that aspect, it can lead to depression. But sometimes over-entertainment is a little bit too much. And these days, over-entertainment is a common theme. We didn't have this before. We didn't have screens. We didn't have something that is so comfortable. We had to actually walk, run, play sports to have fun, right? So yeah, I'm not saying you have to be primitive, but I'm just saying be a little bit more conscious about how would it affect your health in the future and how you don't feel it right now, but people keep telling you about it. I know young people feel bulletproof. I did too. But eventually it will catch up. And everyone says the same thing. I've never seen anyone who says, I can keep doing the same thing until I'm 99 years old. At some point, your body will give up.
Yeah.
The faster you use up the storage, the faster your body will give up.
That kind of makes sense then. So that being said, what are the options or programs that Esperance Clinic has to offer for those who are looking to address their cancer concerns?
So we actually found different tests that to be quite effective. Effective meaning the sensitivity is quite high, right? Genetic testing has developed a long way. I know people, when I say genetic testing, we're talking about, people tend to think about hereditary genes, which means we get from our parents. But I'm talking about the genes that we acquired during our lifetime. We can actually test for genes, whether the bad genes, whether they're being expressed or not. For example, colon cancer, right? Nobody wants to go through a colonoscopy. That's why the guideline says 55 years old. For someone who's not familiar with colonoscopy, that's basically using camera, right? Mm-hmm. And we have to go up the back end and look for any lesions or any nodules to see if there's cancer or not. We have a test prior to this, which is a stool test, which usually looks for blood and stool. If there's blood and stool, that means most likely it's cancer. We'll send someone for a colonoscopy. The sensitivity of that test is like 30, 40, some study says 50. So it's very, very low. So when we switch over to genetic testing, where we test for the expression of a gene, we call it DNA methylation. Can we have the next slide, please? We do see that the sensitivity goes up above 90%, right? Now, this does not replace colonoscopy, but for someone who doesn't want to go through colonoscopy and are not at the age of 55, are not recommended yet, but they feel like, I want to feel safe. I want to make sure I don't have this. Mm-hmm. So I want to do a stool test instead. They can do this, and if it's positive, then most likely we'll send you for colonoscopy to make sure that the problem's being dealt with. So we're able to detect it early in life. And this is where I said being an overachiever for health, right? Mm-hmm. If you're happy with being at that 50% mark, then go for, at the age of 55, wait for the colonoscopy in that age. I'm sorry I put it that way, but that's just the way it is, right? But if you're not happy with that, there's always a way, and it's optional. It's not required. So insurance won't pay for it, right? So this is basically what you have to pay for. So, and genetic testing has become a lot cheaper than before because we can actually sequence it quite fast these days. So it's cheaper than before. I wouldn't say cheap, but cheaper. Okay. And it's just an option. So keep in mind it's an option. If you feel like you need to do it, then that's one of an example. Right? Another example would be a blood test. We can actually detect cancer. We call it ctDNA. Usually when cancer is becoming active, it has to shed ctDNA, circulating tumor DNA. And it sheds circulating tumor DNA before it becomes a nodule, right? So we're able to detect it before. So what we can do is we can do it through a blood test and see if it's positive. If it's positive, then we have to do quite rigorous screening. Again, optional, right? It's not required, but only for those overachievers in health. And I understand that it's not being offered in all healthcare practices. That's why we here actually offer this here, so that we have the right team, the right professionals to not make you too scared. Because I know that sometimes it's scary when something's positive. We can actually guide you through in a way that you feel safe. Because I understand sometimes when there's ctDNA, it's likely, but doesn't mean that it's going to turn into cancer. So we have ways to help with that too.
Oh, that's really good, actually. So that would be all for my questions. Right now, let's see if there's any more questions from the audience, and then Dr. Brian could answer them. Am I able to get cancer if I have negative result from cancer genetic testing?
So that's a very good question. Of course, nothing is 100% in life. This actually is true for every aspect in life. If there's anything 100%, then it's probably not true, okay? Nothing is absolutely 100%. So whenever a result becomes negative, sometimes it can miss, right? That's why we look at sensitivity. When I say 90% or above, keep in mind that those 10% can actually miss some cancer. But 90% is still better than lower percentages, right? So yeah, sometimes people go through a test, we can miss it. That's just limit of detection sometimes. But it happens with all types of tests. Conventionally, like I said, the stool test would The stool test, which I said uses methylation, detects for methylation, whereas the stool test detects for blood. The one that detects blood, when it's negative, there's higher positive rates of cancer in some cases. So conventionally, we don't even have good statistics to use with. But when we have better technology, it doesn't mean that it can't miss. So keep in mind, yes, it can still be positive.
All right, next questions. If I have no risk of cancer, what would you recommend me to do?
When we say no risk of cancer, it's quite subjective at that point, right? So I feel like this question comes from someone who is very health conscious. So they're already interested and they feel like they have no risk of cancer. So the best way is to actually come see a physician, right? And we will assess the risk of cancer for you. And if it's really 0, doing the test will only confirm that you don't have cancer, which is a good thing, right? Which is a good thing, because you don't want to go into a test and you don't want it to be positive in the first place.
Yeah.
So when it's negative, it's a good thing. So if you have no risk of cancer, the test comes out negative, perfect. We'll see each other again in the next 3 or 6 months, things like that, or even yearly. So very good question, actually. This person's actually health conscious.
All right, so I guess we are running out of time, but it's okay. So I guess that brings us to the end of our live session for today. I really hope that you do enjoy the talk and also learn some new things from this topic, and as well as picked up some valuable messages that could be useful for you and your family so that you could improve your quality of life. And if you have any more questions or need additional information, feel free to always contact Esperance Clinic, as we are equipped with physicians and specialists who can give you useful guidance, and that you could also book an appointment in advance for any consultation or treatment, because in Esperance, we give confidence to manage your challenge. And yeah, finally, thank you so much for coming to join us. And thank you, Dr. Brian, once again for coming to join us and give us a very informative discussion. And before we close out today's live, please don't forget to like and share this video as well, so that you could show your support to our doctors and our team. And also, if you would like to tag your friends, family members, or loved ones under this video, it could be useful for them as well in the future. And also make sure to follow us on our social media platforms so that you won't miss out any updates or details. And as always, we look forward to seeing you once again in the next sessions. So thank you very much and have a great day.
Thank you so much, Mira.
Thank
and
you
thank
so
you,
much.
everyone. It's my pleasure. Have a great one.